Double masking does not stop people from catching nor from spreading COVID, and it might actually even raise their risk. This is according to a new study. US health chiefs have been advising Americans to double up if they can't get their hands on a medical-grade mask. They've been doing that since the early days of 2021, claiming that it does increase protection. But now researchers say wearing two masks may actually do the opposite by creating a false sense of security that causes people then subsequently to take unnecessary risks. Let's put this research to NHS doctor, Dr. Veena Babu. Veena, welcome to you. It feels like an old story, this, doesn't it, talking about the efficacy of masks? It feels like an age ago, but we are still discussing it in the context of this particular study. I mean, in the depths of COVID, what was the state of your PPE in the surgery where you are? Was it the simple mask we all wore, double masking, the full medical grade stuff? How much confidence in it did you have?
It was just the simple stuff, Colin. Good to be back. And you're right, this feels like a very old age topic now, because I don't think we in the UK were encouraging people to have double masks. And it just was not the dialogue we were having. I was in hospital last week itself, and people are rarely even wearing a single mask. So the concept of even trying to get them to double mask is, it wouldn't be received well by the British public, I don't think. But the evidence does show. So what it did show in this particular study from Florida is where you have two masks, particles can get trapped in between. So even if you're coughing or sneezing, the virus doesn't exactly stay within the first layer. It could just get trapped in between. And as you're handling it, moving from place to place, breathing and talking to different people, there's an increased risk of you then spreading it to others. So in essence, it's not going to make much difference.
Veena, I hesitate to ask you this question, but because it's you, I will, because you're very good at thinking on your feet. We were doing a story this hour reflecting on what Sajid Javid has said about the NHS, elements of the NHS, some trusts being guilty, he says, of foot dragging when it comes to lifting COVID regulations. I'm not asking you to comment on what he said. I just wonder whether you reflect on the fact that it does seem patchy. You can go from, one institution to another, one hospital to another, maybe you know better than most of us, and see a big difference in approach to COVID regulations, even though we are now meant to be living with COVID.
Yeah. I think I feel quite confident in talking about this because in hospitals, I think we've done things as a unison. So yes, as the public, there's always been a bit of flexibility, if I'm honest, in terms of what you want to do on the trains, in public transport, when you're seeing your friends, family. There was a time we were telling people to meet in sixes, groups of six, opening your windows and doors and all of this. But hospitals and clinical settings didn't really change. Patients were still had to wear masks to enter a GP practice or a hospital. Practitioners still to this day are wearing masks and PPE. I do baby clinics where I'm completely gowned up when I see the babies. When I'm doing A&E shifts, I'm wearing a mask. If I'm doing any invasive procedures, I have to have a full PPE kit. My colleagues on respiratory wards are completely in PPE. So I don't see anything having changed in clinical settings, albeit I think things may have changed in a social setting from the public's point of view. Yeah.